Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and you can connect with me on other social media platforms. Please enjoy this sports medicine video. Today's episode of Dr. Ozello's Sports Medicine Report is on a very common sports injury. That is Achilles Tendinopathy. Achilles Tendinopathy is a disorder that I see in my office all the time. It is an overuse injury. So I'm going to go ahead and first of all I'm going to explain the anatomy, and then I'm going to speak about the mechanism of injury, the overuse injury. The Achilles tendon is the strongest and largest tendon in the entire body. It connects the calf muscles, the gastrocnemius, and the soleus muscle to the heel bone. In medical terminology, the heel bone is named the calcaneus. So throughout this video, if I say calcaneus, you know I'm speaking about the heel bone. But what the Achilles tendon does is it attaches the calf muscles, like I just mentioned, the gastrocnemius and the soleus muscle, to the calcaneus. When the calf muscles contract, the Achilles tendon pulls the calcaneus backwards and upwards, or in medical terminology, posterior and superior. That moves the ankle into a motion called plantar flexion. If we are standing and we have our feet flat on the floor, when we perform plantar flexion, let me say that again, plantar flexion. When we perform that motion, we go up onto the balls of our feet. When we are sitting down and we perform plantar flexion, the front part of the foot, or the top part of the foot, called the dorsum of the foot, moves away from the shin. So plantar flexion is a normal ankle motion that is performed when the gastrocnemius and the soleus contract concentrically. Now back to the Achilles tendon. The Achilles tendon is the strongest and largest tendon in the body. It is extremely strong and is extremely durable. It can withstand forces much greater than our body weight. It can withstand repetitive forces much greater than our body weight. It is a tendon that works extremely hard with every step that we take. Now, what is a tendon? A tendon is strong fibrous tissue that connects a muscle to a bone. When I speak of tendinopathy, like I said, this class is going to be about Achilles tendinopathy. When I speak about tendinopathy, tendinopathy is a disorder or a disease of a bone. Achilles tendinopathy is an overuse injury, so we're going to be speaking about a disorder of the Achilles tendon that occurs because someone is doing too much training and not doing enough rest between their training sessions. Like I just stated, Achilles tendinopathy is an overuse injury. Overuse injuries occur because there are three factors present. First of all, too much training. Too much training. Many times the athlete is doing too much too soon. You combine that with inadequate rest between training sessions and some type of biomechanical fault. When we speak about too much training, what it is, it's this submaximal repetitive load over and over and over again. So it's repetitive submaximal load that is putting too much pressure on a certain body part. And then we don't give that body part or the entire body a chance to recover from the training session. And if there is a biomechanical fault, that body part will become injured. Now, when I speak of a biomechanical fault, I also call those the intrinsic factors, things that are going on in the body that cause the injury to occur in this area. In most Achilles tendinopathy injuries, that biomechanical fault, the intrinsic factor, is hypertonicity or tightness in the Achilles tendon. Now, that tightness can be there because those muscles have just been the muscles in the tendon have been overused, causing it to tighten up, or there can be something else going on that is causing that area to carry too much of a load. And what I mean by that, there can be weakness in the feet. If the feet muscles are weak, then the calf and the Achilles tendon has to carry a greater load. It has to work harder. So there's an increased workload being placed on the muscle and on the tendon. So it is a precursor for injury. Also, ankle weakness or ankle instability. If there is instability in the ankle, the calf muscles and the Achilles tendon also have an increased demand or increased workload. So that causes them to tighten and to fatigue quicker. So that can be the intrinsic factor. So there's several things that can cause those muscles and that tendon to become hypertonic or extremely tight. So we have to look at all of those as the source of this injury. There are the extrinsic factors, which is too much training and inadequate rest. Then there's the intrinsic factor, which is tightness in the Achilles tendon and tightness in the calf muscles, which could be caused just from the increased workload of training or because there's weakness in the feet or instability in the ankles. The symptoms of Achilles tendinopathy can occur in two different places in the tendon. The first one and most common area is directly at the spot where the tendon attaches to the calcaneus. It can also occur about halfway up the tendon in between the attachment point of the calcaneus and where the tendon begins at, where it attaches to the muscle. So there can be two different spots, one directly where it attaches to the calcaneus and one about the midpoint of the tendon. Now the symptoms of Achilles tendinopathy: pain, tenderness, soreness, pulling sensation, and tightness right in that area. Also, there can be a small bump. You can sometimes see that, but most time you can easily feel it. Also, there may be some localized swelling in that area, and the tenderness can be in the back part of the tendon and also in the sides, and so can that pain. Usually, the symptoms will increase when we're walking, when we're running, especially if we're sprinting or if we're jumping. Anything that puts a great deal of pressure on the Achilles tendon, any activity, if we are doing plantar flexion and we're going up on our toes, that is going to increase the symptoms of Achilles tendinopathy. Think about if you were trying to jump rope and you were on the balls of your feet. That would definitely increase the symptoms of Achilles tendinopathy. The mechanism of injury for Achilles tendinopathy is overtraining. When we speak about overtraining, basically it's just the athlete doing too much too soon. The onset is a slow, insidious onset. The symptoms come on extremely gradually, and then it just progresses, it builds up, it becomes more frequent, and it becomes more intense. The overtraining, like I spoke about, it's just an increased demand where the athlete is doing too much too soon. And that causes the body to break down, and we combine that with inadequate rest between training sessions and some type of biomechanical fault. When we speak about training, just your general training rules, guidelines, whatever you want to call them, you want to increase the intensity very gradually. In what is called the 10% rule is a very good guideline, where we increase the intensity of our training 10% each week at the very most. So you may say 10%, that's nothing. But when you think about 10% increase over a 6-week period or a 10-week period or a 12-week period, that is huge. So build the intensity of your training extremely gradually. And when you formulate your routine, make sure that you give yourself rest and recovery time. Give your body time to adapt to your training. When you give your body time to adapt to training, it will grow stronger and you will progress in your training. You will make the gains that you want to make. Some very important keys that we want to think about when we train. First of all, cross training. You want to make sure that you're doing a variety of types of exercises. If you do the same type of workout over and over and over and over and over and over and over again, you are placing the same demand on your body repetitively. So you switch your workouts, you target the muscles and the joints from a variety of angles, and that will force them to grow stronger, and it will place a variety of workloads on those muscles. So you target the muscles and joints from a variety of angles when you use cross training. The extrinsic factors of this injury I already started to speak about. Like I said, overtraining, inadequate rest between training sessions, but a couple other factors come into mind also. And these are extremely important, and these include your warm-up and your cool-down. We always want to prepare our body for our training, especially if we have had an injury in the past and you're trying to prevent a recurrence, or you have a trouble area. So spend a few extra minutes in that area, just moving it around, getting the blood flowing, getting the synovial fluid moving around in the joints to get that area prepared for your training. And then when you do your cool down, that is a great time to perform your slow static stretches. So you can stretch your Achilles tendon, and you can stretch it from a variety of positions. You can do it while you're standing, you can even do it while you're seated. When you do it, you put your ankles and your feet at a variety of angles to target the entire muscle, to hit to target the entire calf muscle and the entire tendon, to hit all of the fibers extremely well. So your cool down, that's a great time to do some slow static stretching. Now, prevention of this injury. Prevention is paramount. I say this in almost all of my Dr. Ozello sports medicine report videos. Prevention is easier, faster, and less expensive than injury rehabilitation. So do everything that you can to prevent an injury. I've already gone over most of those things, but just want to mention them real quickly. Again, make sure that you do not overtrain. Formulate a plan where you cross-train and you give your body adequate rest between training sessions. Make sure that you warm up and make sure that you cool down. Also, you want to eat properly. Choose the healthiest foods that you possibly can. When you are training, if you start to feel symptoms, take action immediately. Begin your self-treatment and get a professional evaluation. The reason for this is, even if the symptoms go away, the source of those symptoms is most likely still there. That intrinsic source is still there, and the biomechanical fault is still there. So if you get professional treatment, it will help you to eliminate that intrinsic source. As I mentioned before, I'm a doctor of chiropractic. As a doctor of chiropractic, I see patients with Achilles tendinopathy in my office all the time. And this injury is preventable, but also it is treatable if it does occur. As a doctor of chiropractic, the main tool that I use is a chiropractic adjustment. I would look at the entire kinetic chain from the lumbar spine going all the way down, look at the pelvis, the hips, the knees, the lower leg, the ankles, and the foot. And I would perform the chiropractic adjustment, which restores proper motion to the joint and helps to optimize nerve flow. Also, there are many exercises that you can do to help to strengthen your feet and increase the strength and stability in your ankles. So you want to perform those exercises. I have a couple videos on foot strengthening exercises that will benefit you a great deal. So you want to perform those and make sure that your feet are very strong. It's going to help to prevent not only Achilles tendinopathy, but several other sports injuries, several other overuse injuries. So strengthen your feet. In my professional opinion, the foot is the most neglected area when it comes to training. So make sure that your feet are healthy. Our feet are our dynamic foundation. We need them to be healthy and strong anytime we do any type of weight-bearing exercise or activity. So strengthen your feet, stretch your calf muscles. Make sure that you stretch your calf muscles when you are done with training, and stretch your Achilles tendon. Do them from a variety of body positions and a variety of angles. In conclusion, I'm going to summarize really quickly everything that I've been speaking about. The Achilles tendon, extremely strong and durable structure, but it can be injured just like any other structure in the body. So we want to make sure that we have a good training technique. We want to make sure that we have a good training routine so that we give our body adequate rest between training sessions and that we cross-train so we give our Achilles tendon and the muscles adequate time to grow and to recover. Attack your body from a variety of angles when you are training. Also, remove any of the intrinsic factors. If you have weakness in a structure, work hard to strengthen that structure. If you have tightness in a structure, work hard to decrease the tension and increase the flexibility in that structure. So when we speak about Achilles tendinopathy, you want to make sure that you stretch the Achilles tendon and the calf muscles, you strengthen the feet, and you strengthen the ankles. That's going to help you a great deal to prevent this injury and to rehabilitate this injury. If symptoms should occur, seek professional help. Do not hesitate. Do not try to self-diagnose your injury. Get professional care to help you, to guide you and point you in a direct path of your treatment. It will help you a tremendous amount. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report on Achilles Tendinopathy. Achilles Tendinopathy is a chapter in my book. Please go to my website, Championship Chiropractic, where you can receive additional information on the book. The book is called Running, Maximize Performance, and Minimize Injuries. Again, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you a great deal for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to leave questions, feedback, or suggestions in the comments section below. Also, please feel free to give me a thumbs up and like this video. Always, always remember, train hard, train smart, stay injury-free, and accomplish your goals.